what do you see as the most common symptoms that our audience should be aware of?
Yeah, I'll go through the common and then I'll go through the oddities, because there are a couple of weird ones that are almost keynotes for mold. So the common ones are fatigue. Usually there's some sort of gut disruption because these mycotoxins do go to the fatty or tissues in our body, and our gut is really very fatty. It's lined with fat. So fatigue because of the mitochondrial changes and also because of brain fog, so it affects your brain function. Again, our brains are mostly fat. Most of us are fatheads. If you're lucky, you have a fatty brain, so these mycotoxins can go into these fatty tissues. So you can start to see fatigue makes sense. Brain fog makes sense. Gut disruption makes sense. Some kind of skin thing. A lot of people have skin changes, and that could be taking whatever your Achilles heel is and making it worse. So if you're prone to acne, it's going to push it to more acne and more cystic, more inflammatory. If you're prone toward rosacea, then you can get a little aggravation of the rosacea. If you're prone toward aging skin, we'll see more age spots. So that's a very common one, that people have some sort of skin change. The oddities, which are very interesting, is ear ringing. And if we look at the number one medication that causes ear ringing, it's antibiotics. And a lot of antibiotics are actually mold toxins. They're made from fungus, and they're used to kill off the other living things in your body, like bacteria. So we see ear ringing is a really common thing that people that are being exposed to mold describe. You can definitely have sinus issues and things like that, even if you're not exposed to spores, just because of the irritation of the respiratory passages. So we might see some kind of sinus congestion or something where people maybe have trouble breathing at night, and they kind of lay down and slow down. If they're in their moldy environment, that's going to all swell up and have trouble with breathing at night. Insomnia is very common. Anxiousness, I almost said anxiety. So I always catch myself. It's not to the level, although it can be the level of anxiety disorders where someone needs medication. A lot of people with mold describe kind of an inner sense of feeling restless, or like things just aren't okay. And they're right. That's their body saying, yes, you're in an environment that's harming you, but you don't see it. So you can't pin it on anything in your environment. So they just feel just restless and anxious, which can impede sleep, and which can, that can definitely be worse in the environment, better out of the environment. So those can be little clues. Another oddity one is bladder irritation. So a look sort of like interstitial cystitis or pelvic pain. Those are things that are highly correlated with mold exposure, because the pathway of that mycotoxin through the body, it goes through your respiratory passages to your bloodstream, and then it takes a Y in the road. That mycotoxin either go to the liver to be processed out, or it goes to the kidneys to be processed out. And out while they're in the bladder, they're bumping into that bladder wall and irritating it. And you can feel like you have a bladder infection even if you don't.